Fantastic. Thanks everyone for joining. I'm going to go ahead and call our meeting to order. You can go to the first agenda item, which is a roll call to establish quorum. I'll turn it over to Mary O'Leary with SEI to call the roll.
Thanks, Chair Johnson. Uh, Chair Johnson, I know you're here.
Present for the record.
Thank you. Member Nelson.
Yes, I'm present.
You. Member Cheatham.
Present.
Member Shanae.
Present.
Member Lance. Member Morgan.
I'm here.
Senator Neal. And Member O'Bannon. And I did hear from Member Lance and Member O'Bannon that they would be missing today's meeting, and I heard from the senator that they would be joining about 30 minutes late. So we have 5 out of 8, and that is quorum.
Fantastic. Thank you, Mary. Before, yeah, I'm going to come back to our meeting goal for today after public comment. So we can go ahead and move on to agenda item number 2, which is our period of public comment. I'm once again going to turn it over to Mary O'Leary with SEI to ensure we're in compliance with public comment. Mary?
Thank you, Chair Johnson. So public comment will be received via Zoom by raising your hand or unmuting yourself when asked for public comment. Public comment shall be limited to 3 minutes per person. No action may be taken upon a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action may be taken per NRS 241-021. If you are dialing in from a telephone, please dial 253-205-0468. When prompted, please enter the meeting ID 813-0733-6896. And please press *6 so that the host can prompt you to unmute yourself. We also ask members of the public to refrain from commenting outside the designated public comment periods unless specifically called upon by the chair. And I will also drop some guidance. Please do not use the chat function as this is limited for those that are calling in. So please wait until public comment to make your comments.
Thank you, Mary. Do we have anybody here for public comment?
I don't see any hands raised or anyone coming off mute.
All right. I'll wait just one more moment. All right, wonderful. With that, we can move to agenda item number 3. This is our review and approve the minutes from the March 18th, 2026 Prevention Subcommittee meeting. Before I call for a motion, I just want to ensure that folks are clear on the guidance that we received from the DAG on our November 5th, 2025 meeting, that members can vote to approve even if they were not present at a meeting as long as they've reviewed the minutes. So I just wanted to make sure that that guidance was fresh for anyone who it's a few months in the past, so wanted to make sure that that guidance was fresh for everyone who is here. Um, uh, this is Jessica Johnson for the record, and wondering if we can call for a motion to approve the minutes from the March 18th meeting.
This is Wendy Nelson. I motion to approve the March meeting minutes.
Thank you, Member Nelson. Oh, sorry, who was that? It just came off mute. Was
I'll
that a
second Noel Shanae.
All right. A second from Member Shanae. All in favor say aye. Aye.
Aye.
Aye.
Any opposition? And any abstentions? All right. That motion carries. The minutes are approved. We can go ahead and move on to agenda item number 4. So I wanted to just kind of state the goal for today's meeting up front because we do have quite a bit of review, voting, and work to do. So good news that we all just got to practice approving a motion because there will be lots of opportunity here today. So really, our goal is to finalize our wording and approving the recommendations that we want to appear in the 2025-2026 SURG annual report. And then we will be ranking those recommendations after they're approved as a subcommittee. So we'll go through those in a few different agenda items, and that Mary has shared, Mary SEI has shared and prepared for the subcommittee meeting. So I wanted to start with new prevention subcommittee recommendations. So after our full April SURG meeting, I had an opportunity to connect with Anne Elizabeth from CASAT, who shared a presentation on the certification programs that CASAT runs and discussed specifically about gaps in the Certified Prevention Specialist certification supervision. And Anne Elizabeth was able to share some more details and context and a a recommendation that would help close those gaps. However, it's really still in a workshop format. So I wanted to just be transparent and on the record with the committee today about that follow-up conversation. I don't have anything specific to present today, but I do look forward to sharing it at a future meeting about this recommendation to hear your feedback and details and see if it's something that we want to consider. If anyone is interested in helping to workshop a recommendation around the Certified Prevention Specialist certification supervision gaps that were identified, or taking it on as a sponsor, please let Mary know or myself know as chair. If there's nobody that is specifically interested in that area at this time, that's totally fine. I'm happy to work with Anne Elizabeth and other partners uh, to kind of finalize that wording or to finalize the draft recommendation to bring that to you all for edits and approval. But I don't plan to have that for this particular year's report. I just wanted to elevate that for you all. Any thoughts or discussion, questions for me or Mary? Go
Jessica,
ahead.
this is Wendy. I would like to be a part of that as well, if possible.
Fantastic. Thanks, Member Nelson. Noel?
I was going to also offer to support that process.
Okay, wonderful. Mary, maybe I can connect with you so we don't have any open meeting law um, uh, concerns. But I love for Member Shanae and Member Nelson or Member Nelson to take that on and bring it to a format for our committee to fully vet. A really great opportunity and something that we've as a subcommittee strategized around in the past. So it'd be wonderful to have something that could close any gaps identified there. Thank you, members. Seeing no other discussion on this, I'm going to move to agenda item number 5. This is our sort of first big task of the day.
Chair Johnson, I just want to note for the record that the senator has joined us. So
Fantastic. Welcome, Senator Neal. Agenda item number 5 is to review and approve the proposed 2025-2026 Prevention Subcommittee recommendations. Mary sent over a handout for additional details that go into the background and justification and all other areas of these recommendations. On the screen that you'll see here today is kind of we'll be reviewing the finalized wording and then one by one be calling for, after some discussion, be calling for a vote to include those in the 2025-2026 report. Does that make sense to everyone? Just making sure. Okay. All right. I'm seeing some folks on the screen nod, so that's really helpful. All right. We can move to the first recommendation. So this proposed recommendation was presented at the full surge in April. This is to request guidance from the Nevada Board of Pharmacy to be posted on their website and communicated to pharmacists to clarify regulations pertinent to the distribution of naloxone in hospitals, to permit low barrier naloxone distribution from emergency departments and permit emergency departments to adopt a naloxone specific standard operating procedure for public naloxone distribution separate from and exempt from the regulatory framework surrounding hospital formulary medications used in patient care. Um, when we presented this, there were some clarifying questions asked, but no proposed revisions or recommendations added. If approved, the subcommittee would work with Board of Pharmacy to workshop the language that is proposed for the post. In the supplemental information, there's a pretty specific language recommendation that's adapted from the National Bridge organization that's been effective in many other states in the associated research section and research documentation section of the larger report. So that would be provided as recommended guidance for posting. Any discussion or questions from the subcommittee on this recommendation?
I have a question, Noel Shanae.
Go ahead.
And not being familiar with the national guidance, I am in my head, and I'm trying to think like an emergency department. What does reimbursement for that naloxone distribution look like as far as billability? And I'm trying to think of like where are the carrots for them to really build that capacity within the EDs? Should we pass such a recommendation and it move forward? And that may be outside the realm of this, but wanting to make sure that there is some more specific guidance as is developed as to how this naloxone will get paid for, where it will come from, if it's going to come down from the state, knowing that there have been gaps in distributions even from the state and capacity to keep up and looking at this expansion. So I don't know if you have any additional information on that or if that's something to flesh out later.
Yeah, thank you, Jessica Johnson, for the record. So I really appreciate that question. So it is a little bit out of the scope of this particular recommendation, and this would allow for hospitals to distribute like community-based distribution of naloxone. So it would be out of the purview of the hospital pharmacist. This having received a presentation from Board of Pharmacy, this is something that is currently allowable. However, what we've heard from multiple partners is when working with hospitals to implement to implement opportunities at the emergency department for community-based distribution of naloxone, they often run into a barrier of hospital, and I'm paraphrasing, so there are folks on the subcommittee who are more detailed experts in this, please hop in, but they run into a barrier because hospital pharmacists are responsible for medication distributed in the emergency room. So this is something that several hospitals I'm aware of are doing, but not all of them universally. And in other states where there's been a lack of clarity, they've been able to work with the Board of Pharmacy to create a statement that just clarifies sort of this relationship for being a community distribution site of naloxone, much like maybe a behavioral health treatment center or recovery community organization or a coalition, a health department, in that similar vein. Does that answer your question?
That is very helpful. Thank you. And so in hearing that background and that those clarifications have come through, because as you were speaking, my next thought was wondering if we should put that clarification in here that we're talking about community-based distribution. that would leave that up to the group if they want to go that far. Just thinking about the hospitals, many of them are concerned about their bottom line, and if there would be worry about such a recommendation of, how do we provide this service, because of course we want it to be provided in that community based. So making
Yeah.
sure it's palatable to all, if
Yeah.
that makes sense.
Thank you. Jessica Johnson for the record. So I think my attempt to do that is in this last sentence here, in the submission of it, that is separate from and exempt from the regulatory framework surrounding hospital formulary medications used in patient care. And then in the accompanying document, has a lot more detail related to these efforts, but open if you have a specific recommendation or specific language update that could make that clearer here, open to that.
Noelle Shanae, for the record, I'm just thinking it through in my head as I'm reading, so I
Yeah,
didn't.
no
I
problem.
totally, I don't want to not acknowledge your question, but it's the workshopping in my brain, so I will.
Definitely.
And if it's just me that thinks this, then
Yeah,
for sure.
yeah, open to if other folks have language updates that would be beneficial here, or that member Shanae has raised, open to hearing them for editing. I do think one challenge that we face in creating these recommendations is to summarize them in a description that is relatively succinct when there's a lot of new, like, especially this in particular is a gap that many folks who have worked on having emergency rooms in particular being naloxone distribution sites have identified as a barrier for increasing adoption. Other members, any specific additional wording or recommendations? I'm seeing Kyra shake her head no.
Noelle Shanae, for the record, the one thought, and it's probably more of a synonym, so might not make a difference. Would you could change out public for community in that last sentence, or for community-based naloxone distribution? Again, that's a maybe more of a semantics thing. I was just trying to think of a different way to word that. So, I defer to the group. So.
Thank you for that recommendation. Thoughts from the group on the recommendation as amended?
This is Kyra. I think it's fine as written.
As currently written?
Yeah.
Thank you for the input. Any additional discussion on this recommendation? If not, I would entertain a motion to uh, move this recommendation as amended forward into the 2025-2026 SURG report.
This is Kyra Morgan. I'll make a motion to move this recommendation as amended to the 2026 SURG report.
Thank you, Member Morgan. Do I have a second?
Noelle Shanae, second.
Thank you, Member Shanae. All in favor, say aye.
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 Aye. Any oppositions? And any abstentions? Hearing none, this recommendation moves as amended into the 2025-2026 report. Great job, everyone. Just a few more. All right. This recommendation was also presented at our April SURG meeting. As presented was to create a bill draft request to set aside cannabis wholesale tax to be distributed using a local lead agencies model to reach $2 per capita, a recommended funding goal from the Nevada Tobacco Control and Smoke-Free Coalition and subject matter experts. We did receive some feedback on this in late April based on emerging data around youth vaping. I know our experts from the Nevada Tobacco Control and Smoke-Free Coalition had many recommendations for this subcommittee out of their particular presentation. And based on this, coupled with data presented at the interim health committee related to youth vaping, um, sub this recommendation was proposed to be amended with the details that you see here. So moving from the cannabis wholesale tax to setting aside funding for youth vaping prevention specifically, and with a note that given that vaping is really a delivery method for cannabis, nicotine, or other substances like fentanyl, multiple funding sources should be considered, including the cannabis wholesale tax, the tobacco or vaping settlements, tobacco tax dollars, the Fund for Resilient Nevada, or other appropriate funding sources. So opening the background and justification and research links were also updated to reflect these additional resources in the attached document. So open to a hearing discussion from the committee about this recommendation as amended.
I think that really changed it. This is Wendy Nelson. From because the whole point was trying to get a wholesale tax from cannabis, wasn't it? So that's
Yeah.
interesting.
And if I can just add, Member Nelson, oh, sorry. We had previous SURG reports had two recommendations, one for tobacco and one for cannabis. The cannabis one was carried forward with kind of an ongoing in the presentations that we received from the Nevada Tobacco and Smoke-Free Coalition, kind of an underlying discussion about the delivery mechanism of vaping. And so open to not including these edits. So that's something the committee could go back to the original one, open to if we could keep the cannabis one and have a vaping one too. So there's a lot of options here if depending on what the subcommittee recommends.
This is Kyra Morgan, and I just have a question, I guess, and I don't know if the committee knows, I'm kind of new to this committee, but were we focused on the cannabis wholesale tax because it's newer and therefore potentially more available than the other two funding streams? Because I didn't know that when we had the meeting with the amendments. I didn't recognize that the whole point of this was to be able to get some of that cannabis wholesale tax funding. And so in that context, it made sense to me to like be less limiting and to include other funding streams. But I wonder if it was strategically limited to one funding stream because that funding stream has more opportunity and therefore maybe it actually dilutes it to broaden it to other. So I'm just curious about that.
Yeah, that's an excellent question. This is Jessica Johnson for the record, and if anyone recalls more details, happy to hear from other members. My recollection is that our the presentation had multiple recommendations, and related to the one on cannabis, there was a discussion about the wholesale tax and the retail tax, maybe, and I don't want to misquote them, and that the retail tax had been allocated for education. and that the wholesale tax, maybe there was additional opportunity there to allocate specifically for prevention. So I recall that there was in that discussion a specific recommendation for um, the wholesale tax as the funding source when it was just focused on cannabis. I do see your point about kind of broadening the the funding channels as moving into a vaping specific recommendation. I'm wondering if other members share in that and have any recommendations on how to improve or change this recommendation as currently amended.
Noel Schnee, for the record, the part of this recommendation that really stands out to me is that other appropriate sources. The sources listed, cannabis wholesale tax, tobacco vaping settlement, tobacco tax dollars, fund for a resilient Nevada. Those tend to all be kind of directly tied to vaping in some way or another. Fund for Resilient Nevada is a tobacco money, right? The other appropriate sources to me is where it really waters down, and that's where it kind of clued in for me. One of the things I think might be beneficial is that some flexibility around the cannabis wholesale tax. While I do hear what you say, Kyra, I'm sorry, about watering it down, at the same time, cannabis is still federally illegal, and I think there's still a little bit of uncertainty in what direction that will go. And so making sure that there is continued funding to address vaping and some avenues to build that funding for prevention, and that we're not so narrow on cannabis when it is federally illegal still might behoove us, if that makes sense.
Yeah, thank you for your comments, Member Shanae. Just for the record, the Fund for Resilient Nevada is the opioid settlement funding. It's okay, they
Apologize.
all
Fund for
have,
Healthy Nevada is
yes,
the tobacco. Apologize.
yes, you're correct. The Fund for Healthy
Yes.
Nevada was the tobacco one. Thank you. And in keeping other appropriate sources, the attempt there was that sometimes settlements like the Juul settlement on vaping products and other things um, happen in the course of this time, and there may be within that opportunity to set aside funding for youth vaping prevention using this particular model. So, in drafting this, I didn't want to just beholden to the things that were in our scope and awareness today in case new settlements or lawsuits or opportunities came to light where we could where the entity, so the Attorney General's office or the state or whomever was responsible for that lawsuit, could opt to allocate it with this particular model for vaping prevention. Hopefully that makes sense.
Noel Schnee, for the record, that does make sense. Maybe we could narrow it to, substance use related or something. Also, I do see where during the different budgeting cycles, funds are kind of moved around. So, there is always that, robbing Peter to pay Paul when we provide too many options instead of just adding to the pot, because nothing gets cheaper over time, and that's inclusive of prevention. So.
Yeah, thank you for those comments. So in terms of other appropriate substance use sources, or other future identified funding sources, what would either of those close the gap on that last piece for you?
Um, Could it be or other appropriate sources as related to substance use?
Sure.
How does that sound to everybody?
Any input from other subcommittee members on the recommendation as currently worded?
This is Kyra again. I'm fine with the changes.
Thanks, Kyra. Other discussion from subcommittee? Any thoughts?
No, Sinead, just a thank you for the heavy lift on developing these while I'm thinking about it.
Really grateful to be on this committee and have the opportunity to get to put these together, and grateful to have such an engaged committee for discussion. So thank you all. There's no additional editing. I entertain a motion to approve the recommendation as amended for our 2025-2026 SURG report.
Noel Shanae, I would like to move forward the recommendation that we motion that we include this on our 2026 report.
I have a motion. Do I have a second?
This is Chelsea Cheatham. I second that motion.
Second from member Cheatham. All in favor say aye.
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 Any opposition? And any abstentions? All right. This recommendation moves forward as amended. Nice job, everyone. That's two. So while both of these were presented at the full April SURG meeting, we did make mention of a few other recommendations that we were working on. And so I didn't want to pass this opportunity to workshop and include those. So if there are things that we don't feel ready in our discussion, it would be helpful to hear. If you'd prefer to defer them to a later report, we can. That doesn't mean we cancel them out. That means we keep them on our list and keep working on them for the following year report if we need a little bit more time. So I wanted to start with this recommendation that was originally elevated by prior subcommittee member Eric Schoen, and then sponsored by, I think, myself and Wendy, who's done some on the side, some background work on this from our last meeting. So as written currently was to support, and I think we were looking for an identified partner or agency who could introduce a bill draft request in the 2027 legislative session that would double the annual state investment in primary prevention via a general fund dollar item committed to the Bureau of Behavioral Health, Wellness, and Prevention. Hopefully, I got that correctly. Prevention programming for people aged 0 to 24. The monies should be directed to local lead agencies that prioritize evidence-based programming. And then there's an example of what this investment would look like. So if the current level of investment was 1.6 million, then this would be raised to 3.2 million for the next biennium. The funding should not be at the expense of existing programming and should be the state of Nevada's contribution to prevention efforts. Additional federal and/or monies that are secured would not change the target allocation of state dollars for primary prevention efforts. We did not collect any additional edits. Wendy, remind me, is this the one that you were working on additional background for? I'm seeing you nod, so I'll turn it over to Member Nelson to share her background work.
Yeah, so I was looking into it and I had some thoughts, one with a fiscal note and one not. And let me go through it a little bit. I sent an email out to you, and you you probably haven't even seen it yet. But anyhow, without the fiscal note, what I was thinking is strengthening NRS 458.033, which clarifies that certified prevention coalitions are primary regional prevention coordination entities, essential community prevention infrastructure, require stakeholders of prevention planning and funding coordination. Section 2 would be local prevention governance protections, to require the division to collaborate with certified prevention coalitions, preserve local prevention flexibility, recognize regional prevention priorities, avoid unnecessary duplication of prevention services, evaluate infrastructure impacts. Section 3 would be prevention coordination and non-duplication standards. I can go through some of those. Section 4 would be administrative continuity protections. Section 5 would be statewide prevention initiative standards. And Section 6 would be rural and frontier equity protections. And I have a Section 7 for annual legislative reporting requirements. I have one with a fiscal note, and I can send this out so that you can see it. But it would be to obviously have the funding doubled. It would be to establish a protected general prevention infrastructure line item administered through behavioral health and wellness program. The funding purpose is certified prevention coalitions, evidence-based prevention systems, rural frontier prevention infrastructure, prevention workforce retention, youth prevention services ages 0 to 24, and community-based prevention coordination. Proposed level funding, as you mentioned, the 1.6 annually to 3.2. The intent would be supplemental federal funding to supplement federal funding, stabilize long-term prevention infrastructure, preserve local preservation flexibility, support workforce sustainability, protect existing coalition systems, reduce instability caused by shifting administrative priorities. And federal funding should strengthen Nevada's prevention systems, not determine whether those systems survive. Infrastructurally, what's happening is there's been a lot of funding that has come into the state through the opioid funding, and so it kind of watered down some of your infrastructure. It's been given out a lot, and there's been a lot of duplication and things like that. So with the fiscal note, that would be the doubling of it. Long-term prevention investment reduces state expenditures associated with behavioral health crisis, juvenile justice, emergency response systems, foster care, substance misuse treatment, school intervention systems, homelessness systems. Maintaining prevention infrastructure is substantially less expensive than rebuilding destabilized systems after administrative disruption or economic downturns. With how our economy is and with the unstable funding, because we are relying on a lot of gaming and things like that, during those times, you can end up losing your infrastructure. And so it would be nice to have, like the key legislative statement could be, Nevada's prevention infrastructure was built locally through decades of community collaboration, trust, and partnership. Statewide coordination should strengthen, not replace, community-based prevention leadership. I have a really lengthy thing about it, and then we could, make it succinct. But really, it's about protecting the infrastructure that's taken years and years to build in all these communities. It's been built from the ground up. And every time, with COVID happening, we have, a downturn in economies multiple times now. And then we'll get a flush of money, but then it, how it's distributed and how things go can really even make that more unstable and have a lot of duplication. So I do have, let me see how many pages, quite a few pages of research of things that would be helpful. And I can send that out, and then maybe for the next meeting or whatever, people can have a copy of that and see what they think. It's taken me a little bit of time to get it pulled together, but that's what I've come up with.
Thank you, Wendy. I just wanted to note that Ira Morgan had to jump, but we still have quorum with 5 out of 8 members.
Thank you, Mary. And thank you, Member Nelson, for the extensive research and background work that you put into reviewing this recommendation.
Yeah, no problem. I sent you a copy, Jessica. And so, you can send to committee or whatever you'd like if they want to review it and at any point and tear it apart. Whatever needs to happen.
No, I really value the time and energy, and we can get that to Mary and distribute the what you found so far, and kind of your recommendation on direction for kind of next steps. Um, so I do so it sounds like based on your current research, Member Nelson, and where we're at, that uh, this recommendation would be served. Are you, I don't want to read through the tea leaves, so let me ask directly. Are
Yes.
you, are you wanting some more time to workshop this and have it be in next year's report?
It might be good to really have everyone look at it and see, because you can do it with a fiscal note or without. I mean, if we're going to just strengthen up, like I said, NRS 458.033, you can do it without a fiscal note, which is easier to get through. But I mean, what's our end all? You know what I mean? What we really are trying to do is probably preserve infrastructure. So, whatever your guys' thoughts are, I'm happy to do whatever.
Yeah, before I turn to member Shanae, just so something to consider for this committee and what we decide to do next is that if this were something that we would want to happen in the 2027 legislative session, it would need to go on this year's report to be considered as a recommendation during that session. This if not, then that we want some more time to workshop it, then it would be on the 26-27 report, which does not then is not followed by a legislative session because that would be in early 2027. So just for consideration in our discussion. Member Shanae, go ahead.
Thank you, Chair. Member Shanae, and you did clarify some of my question. I wanted to just check in when we're talking next year versus this year. With this report, our goal today, one of them is to elevate what will go into the SURG recommendation, right? So this will be our last opportunity to really workshop anything that will go before the full SURG committee prior to the 2027 legislative session, if you will.
That is my understanding. I do know that Mary O'Leary from SEI has a very firm grasp on all of the to-dos between now and the final published report. So, Mary, what else would you add to Noelle's question and comments?
I would say yes, today is really the last really try to push them into this year's report, and this year being 2020, 2025, 2026. So if you were to delay this recommendation to next report, which is fine, it wouldn't be released until summer of 27, so it would miss legislative session. So just depends on what direction that you want to go with it.
Noel Schnee, thank you, Mary.
And that we have elevated several recommendations over the years and iterated them, this being one of them, as we've had more research and insight and opportunity to continue to add to this, or as things are implemented by folks identified in here in recommendations, then they've sort of evolved over time to address the next set of gaps. So one strategy this committee could consider um, could be to either make amendments to this as is, move it forward in the 2025-2026 report, and have member Nelson submit her research through the um, Survey Monkey and continue to workshop based on that feedback for the 2027 report. Those meetings where they're being workshopped will be public, so could help inform if this recommendation for a bill draft request were to get picked up. So that could be one idea. Another idea would be to pause on this one and edit and hold it from the 25-26 report and edit based on the information presented today. So we could have two. We could have one that we continue to refine. Or we could have none. So a few um, options for consideration.
I think as written, it's not like a terrible thing. It really encompasses a good portion of what I've studied, and I mean there could just be some wordsmithing, but I guess it depends on the appetite of the committee to move this forward. I know it's been sitting here for a little bit with Eric in 24, so I guess it depends on the appetite of everyone and what their thoughts are.
Wendy, based on your research, if we were to edit this one, is there specific language in here that you'd recommend updating?
I think just protection of infrastructure would be smart because, like I said, and our counties are actually the ones recommending that. So I think that, there could just be a little language in there to support that.
Thanks. Thanks, Mary, for moving into editing mode. So for example, would you say, skipping to the second line and introducing a bill draft request in the 27 legislature that would double the annual state investment in primary prevention to protect prevention infrastructure?
Yeah, I think that's our main thing. It's really what's happening right now is things are becoming very treatment focused, which is great. But on the front end, you protect, you really save so much money if you're doing prevention, and the money saved in the long run actually saves you so much more on the back end. And like I said, with the funding that's been flowing through, it's watered some down. We're seeing a lot of repetition. I think it's just really good to start looking at preventing your infrastructure from falling down. It's taken, I know, our coalition has started in the 80s to have alternative schools started, and then it turned into what it is today. And so and so it actually was 2001. So you're talking 26 years of building things, and it could be taken down really quickly in all these communities, right? And we serve 3 counties and share a county with HCC. So yeah, I mean, I know we're not alone in that, but I think it would be really good to try to preserve the infrastructure. And I'm not talking just about us, but anybody that's already has really good infrastructure that's been built through these counties. So yeah, I like your language to protect prevention infrastructure, but that's just me.
Well, thank you again for your insights and research and work so far on working on this. 2 questions for the committee. Thoughts on as amended, and any thoughts on an identified partner or agency? This, I think, to be successful, would still need an identified champion. Um, Member Neil, I don't want to put you on the spot. If you have any thoughts on phrasing for historically, we've just said introduce a bill draft request, and we had feedback in the last report to support a specific entity or partner. So that is hence the brackets for anyone just tuning in as to why it's phrased in that way. And if the senator can't comment today, perhaps when we present this to the main surge for edits, that is either a gap that we are clear about, or an opportunity that we could look for someone who might be interested in this that would be willing to be identified in the report. I'm seeing a technical issue being elevated in the chat, Mary. Wondering if you can help.
I see that. I pressed ask to unmute for Senator Neal, so maybe that will prompt something to pop up.
Apologies, Senator Neal. I know this is also your first meeting, so it can be.
I would just offer Senator Neal, if you're not able to unmute, it may be helpful to call in to join your audio via phone, and we can support you with that. Oh, I do see the senator coming in on a separate one that is not muted, so perhaps that worked.
Senator Neal, are you able to unmute? It does look like you're unmuted now. It looks like it then remuted. SEI team recommendations.
Yeah, my recommendation is that the senator attempt to call in, and I can provide that guidance via an email. Senator Neal, I don't know if you're able to see your email currently. Let me connect with the senator directly, Mary, so that you all can continue. I would just defer to Joseph on whether the senator's inability to unmute impacts quorum, because I believe you do have only 5 members with the senator present. Is that correct?
That is
It doesn't affect quorum in the sense that you guys can continue to go on, but it will during a vote.
I'm going to try to connect with the senator directly to see if we can get that solved before the next vote. So I'm going to go offline for a few.
Thank you, Kim. While we wait on that, Member Cheatham, I don't want to put you on the the spot, but wondering if you have any thoughts on this recommendation as submitted from a prevention perspective.
Sure. I mean, I like the way that it's written right now. I think that it's a solid recommendation. I am curious to see if we should change the language to just introduce a bill draft request, or if the rest of the committee feels it'll be stronger if we do identify a partner. I support the idea of us taking this back to the larger surge and maybe inquiring then to see if we could find a partner or an agency that would be willing to introduce this. But yeah, I think from what I'm reading, this recommendation seems like a really strong recommendation.
Thank you so much for your valuable input, Chelsea. I appreciate that.
Chair Johnson, sorry to interrupt. I noticed that the senator has dropped off the call, so that leaves us with 4. So we have
Okay.
lost quorum. They may be rejoining. So
Okay. Um, what is the recommendation from the DAG and SEI team, given that most of the rest of our agenda is voting on these recommendations?
Hi, Madam Chair. Thanks for the opportunity to opine. I honestly, because you guys are deliberating right now, I kind of would like to stop the meeting until we can get Senator Neal back on.
All right. We will remain on the line and hopefully SEI team, if you can also reach out to Member Morgan and see if she can rejoin, that would be great. We'll take a brief pause until I hear an update from the team.
I'm really sorry, guys. This is Kyra Morgan, and I'm back on the call.
Thank you, Member Morgan. I just want to appreciate you rejoining. Um, uh, SEI team, can I confirm that we have quorum reestablished to continue the meeting?
Yes, Chair, we have 5 out of 8 members. We have quorum.
All right, thank you. From the DAG, do we need to recall the roll, or is that sufficient from the SEI team?
I think that's sufficient. Did she go on record and say she was present?
Yes.
Yes.
Awesome.
This is Kyra. I'm here.
Awesome. Thank you. And thank you, Member Morgan, for rejoining. Um, uh, to pick up where we left off, as everyone relogs in from their email, we were discussing in the description if we should leave the phraseology as support in brackets identified partner slash agency in introducing a bill draft request. Was a recommendation from previous SURG recommendation reports to include a specific sponsor for the bill draft request to strengthen it. Given that we do not have a specific person sponsoring this one at this time, Member Cheatham suggested an edit to the description to just say introduce or support a bill draft request potentially. Um, and bring this up as a gap or an opportunity in the recommendation when we present to the larger committee in June. Thoughts from the committee on this recommendation as amended?
Member Shanae here. A couple
Go
quick
ahead.
questions. Reviewing the justification, I know the justification is indicative across the lifespan, and in this description, we're talking about 0 to 24. So I'm not sure if that is something we would need to align currently or later, or we want to consider that now. And then I would also note that in that justification, though I know we're looking at this recommendation here, it does indicate that the state did not receive PFS funding, but that is no longer accurate. The state does have PFS funding currently, so just an update there. And then regarding this recommendation, specifically the description, I would be curious as to whether this is going to be a continual doubling every cycle. I did notice it said evergreen in the justification, or if we're looking for just a doubling in this legislative year and then maintain level funding going forward. Maybe a little clarification for me there. That's not very clear. And I would also say that we just recommend that it be doubled to 3.2 million if we're looking at just this cycle. So
Thank you for your comments and for thorough review of the document. I appreciate the additional insight. I think we can update the justification from over the lifespan to people age 0 to 24. I think we can include the PRS grant was received, so we can make that edit in the justification. By way of background on the amounts, when this was first elevated in, I believe, the 2023 cycle, the initial recommendation was just to increase. And when we brought that to the larger surge, they said, well, how much do we increase it? And so there was a lot of effort and investment made in really trying to identify an optimal amount, like what are other states doing? How are we thinking about this? Where does this go? And so I think the committee was like, well, what if we doubled it? And would that be enough? And if we doubled it and sustained the doubling, would that large infusion and investment in prevention then help then be able to move us, close all of the gaps? And if it didn't close all of the gaps, what would be that remainder? So I think based on the information that we had and the resources available, there were a few cost analyses by places like the Substance Abuse Mental Health Administration, SAMHSA, and others, but they were relatively outdated that suggested a dollar figure at that time what would have been doubling. So just by way of history, some of how we've arrived today based on other feedback in some of the current language. An example was requested to be included, so I think that's why we have if the current level was 1.6 million, then this would be raised to 3.2 million. I believe that amount was based on the presentation that we received from Stephanie Cook in the fall of last year. Hopefully those comments help with some of the wording that's in here.
Yes, Chair Johnson. Thank you very much. That's helpful to have that history back to 2023. And I do fully support this recommendation going forward. From my perspective, I think it would behoove us to move forward with this and then continue to workshop for 2027 some of the recommendations that Member Nelson, Vice Chair Nelson brought forward, as a tandem for future opportunities. So I think that would be beneficial. And that PFS funding, we could acknowledge that it really only supports a small part of that state. So,
Thank you for your comments, Member Shanae. Given that and the discussion, I would entertain a motion to move this recommendation into the 2025-2026 report as amended.
Noelle Shanae, I move to recommend that this recommendation be elevated to the 2025-26 report.
Thank you, Member Shanae. Do I have a second?
This is Kyra. I'll second.
Thank you, Member Morgan. All in favor say aye.
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 Any opposition? I think that was everybody. And any abstentions? All right, hearing none, this one will be elevated to the 25-26 report. Thank you, everyone, for the detailed discussion and the brief pause hanging in there for any of the technological and other issues. We have, I think, 2 more recommendations to review. I'll highlight this one briefly. Member Lance submitted this on March 6th. We mentioned it at the April larger SURG meeting. No updates were recommended at this time. However, with Member Lance's absence today, and I believe she was still exploring this recommendation being a joint recommendation between prevention and response, I'd like to give this a little bit more time and opportunity to be workshopped or jointly workshopped between prevention and response. I do see that SURG response chair, Dr. Kearns, is on the line today. Dr. Kearns, do you have any further discussion on this recommendation? Was the response subcommittee considering it for the 25-26 report?
Terry
Just putting
Kearns
it.
for the record.
Go ahead, Dr. Kearns.
Yeah, we are not considering it for this at this time. We are coordinating with Member Lance to get more information. So we haven't moved on it at this point, but that doesn't mean that we wouldn't consider as we move forward with looking at it for the next year's report.
Thank you so much for coming off mute to share that insight from the response subcommittee. And I'm just putting everybody on the spot today, so apologies. Given that information from the response subcommittee chair, any further discussions on this recommendation? would the committee be in favor of retaining it for discussion at a future subcommittee meeting for the following year's report with more time to workshop and coordinate?
This is Wendy Nelson. I think that's a good idea.
Okay, thank you, Member Nelson. All right. I don't think that we have to vote on it if we're retaining it and moving it and not putting it in this particular report. And giving this some more time to be workshopped with response. So I think that given Dr. Kearns's update and the last conversation with Member Lance, we will hold on this for now. Can move to the final recommendation. This was an elevated recommendation from a previous subcommittee mentioned at the April meeting, but not included for proposal. So this would be to recommend to Nevada DHS, and hopefully someone can make me smarter if that is the correct entity that oversees a report like this, to develop and share an annual naloxone saturation and distribution plan for overdose reversal medication. DHS should utilize opioid settlement dollars to designate a baseline level of identification and overdose reversal medication for the next 10 years in Nevada, which should be based on the state's naloxone saturation plan to create a supply of stable, sustainable overdose reversal medication throughout the state. The distribution should ensure reach and saturation based on overdose burden and ensure it's staffed appropriately to allow for timely turnaround for naloxone access. What you see in red are brief edits to clarify. There was some confusion about biannual, if that's every 2 years or twice a year. So move to annual to clarify. And then this is my ignorance of exactly who in the state might own a policy like this. So I don't know that DHS is overseeing naloxone distribution. So hopefully someone can help amend that if we elevate this. So open to discussion by the committee on this recommendation.
Is it not CASAT that has been doing it?
That's a great question. So from a naloxone distribution standpoint, my understanding is CASAT was distributing naloxone from the state and Southern Nevada Health District. So for transparency, my office at Southern Nevada Health District distributing it throughout Southern Nevada, but received from our partners at the state for distribution. So the last I'd heard from the ACRN meeting is there was some interest in centralizing the naloxone distribution from the state offices, um, uh, not having the Southern Nevada Health District or CASAT be kind of regional distributors of centralizing that distribution. I don't have an update on that. I don't know if there are any members who can provide an update on the status of that. But I do think it is appropriate for us to identify the state office that creates the plan and then would be responsible for distributing the naloxone.
So this is Kyra Morgan. Have we engaged? So I'm with DHS, but I'm with like Division of Child and Family Services. DHS, as you all know, is a huge agency. So have we engaged with DHS to like identify that this is an appropriate that there is an office in DHS that is getting access to naloxone distribution and that actually has this information available? Do we know who that is, if that exists?
Thank you for your great question, Member Morgan. So, Jessica Johnson, for the record. So, my understanding is that this to date has been a responsibility of the office that distributes the state opioid response dollars, and I've heard announced in community meetings that there is an naloxone saturation plan from the state. I was aware of one that was created in like 2022, 2023 timeframe, um, in partnership with the University of Nevada, Reno and CASAT. Um, but I haven't maybe haven't seen a published report or an included report to date. So perhaps based on your question, we could consider um, pausing this and inviting someone from either the oversees the state opioid response grant or someone from their office that could share a plan if it's available with this committee, and help us workshop this a little bit more at a future meeting.
Jessica, would that be Michelle Berry, perhaps?
That's a great question.
That's a great question.
Who works at
Who works at
CASAT?
CASAT?
We
Yeah,
could
I think it might be her that's kind of heading that up. Maybe we'll find
Uh,
out. I like your idea though.
Thank you, Member Nelson. Dr. Kearns, did you have do you have more details on this that you can add?
Yeah, I was just going to add, it's my understanding that this falls under Stephanie Cook and CASAT. You're absolutely correct. CASAT is implementing that plan, and I believe it's out of state opioid response funding that falls under. But Stephanie Cook, who is a member of the SURG, could likely speak to this.
Thank you,
And
Dr. Kearns. Go ahead.
Sorry, and then
Member
this
Morgan.
is Kyra again. I was gonna recommend Don Yohe for Fund for Resilient Nevada alternatively.
Fantastic. Thank you, Member Morgan and Dr. Kearns. So based on this discussion, I would say that we can hold on this recommendation as written and invite Don Yohe and member Stephanie Cook to present at a future prevention subcommittee to help us um, really hone in on exactly what the current gaps are related to the saturation and distribution of overdose reversal medication has been principally naloxone, to my understanding. Um, and see based on their data what they've learned so far around saturation and reach of the medication throughout the state and what the gaps might be. So I think given that, uh, we'll hold this recommendation and invite those speakers to a future meeting. Any further discussion on this recommendation? Hearing none. I wanted to touch base with SEI team member Mary O'Leary. Mary, did we accomplish the appropriate voting that we needed to before I call for a short break?
I heard we have 3 recommendations moving forward that were approved by the committee. I would ask Kim Hopkinson if she is ready to share that document for folks to review as they're thinking about their rankings.
Yes, I can. I have it updated with the 3 recommendations that we discussed.
All right, fantastic. So for those of you following along at home, the SEI team will be sharing the 3 recommendations as amended. We will call for a short break for you to review these recommendations and think about how you will rank them in the next agenda item, which will be agenda item number 6. We'll be ranking based on priority. So we'll go over exactly how many points a 1, a 2, and a 3 are, and each of the rankings, and then all the members will verbally provide which order you have these recommendations in. So what's your number one recommendation, number two, and number three in the next agenda item? Does that make sense to everyone, or would you like us to move to agenda item 6 to explain and then call for a brief pause, since I know we have lots of new members on today?
Chair Johnson, I do also notice that a phone number has joined us, so I'm just wondering if that is Senator Neal.
It, I was going to say, I can confirm the senator and I were texting, so I believe the senator was able to rejoin. And I believe I heard the senator come off mute as well.
Yes, I'm on.
Thank you so much, Senator Neal, for joining our meeting and rejoining our meeting via phone. I really appreciate it. If you're following along on the agenda, we're about to move to agenda item number 6 and take a brief pause to review the prevention subcommittee recommendations that were just voted through for inclusion in the next year's report.
Okay.
So before we pause, would it be helpful for the group? I'm going to move to agenda item number 6 so we can just talk about the ranking briefly, given that we have so many new subcommittee members. And then I'll read through the 3 for everyone to think about while, and then take a brief 5-minute recess for folks to consider what order they would vote on these. So, Mary or Kim, do you mind briefly covering the formula and strategy?
Mary, would you like me to do that? Perfect. I just wanted to note for the record as well that I believe the senator may not be able to see our screen since they are only on the call. So I'm not sure if the senator will be able to rank or be comfortable ranking. So I would just raise that as something to confirm. But what will occur in the next activity is that we will simply ask each subcommittee member to, from 1 to 3, with 1 being the highest, 2 being the middle, in this case 3 being your lowest ranking of the 3, to indicate how you would rank the 3 recommendations that were approved for inclusion in the 25-26 annual report. Each of those is weighted so that a rank of 1 is more points than a rank of 2, which is more points than a rank of 3. And what that should give us is, as we enter data for each person, is the overall weight as well as the overall ranking. And if we see any ties or anything happening, since it's a small number, we'll discuss the best way to approach that.
Thank you, Kim. I'm going to read these recommendations, and then Senator Neal, if you want to let us know if you'd like to participate in the ranking, maybe you know right now, or if you'd prefer to abstain, given that you are just joining now via phone.
I'll have to abstain because I can't see it.
Okay.
I'm sorry.
All right. So the 3 recommendations as totally understandable. I just wanted to add that. Jessica Johnson, for the record, the 3 recommendations as approved are to request guidance from the Nevada Board of Pharmacy to be posted on their website and communicated to pharmacists to clarify regulations pertinent to the distribution of naloxone in hospitals, to permit low barrier naloxone distribution from emergency departments, and permit EDs to adopt a naloxone-specific standard operating procedure for community-based naloxone distribution separate from and exempt from regulatory frameworks surrounding hospital formulary medications used in patient care. The second recommendation is to create a bill draft request to set aside funding for youth vaping prevention to be distributed using a local lead agencies model to reach $2 per capita, a recommended funding goal from the Nevada Tobacco Control and Smoke-Free Coalition and subject matter experts. The asterisk reads, given that vaping is delivery method for cannabis, nicotine, and other substances like fentanyl, multiple funding sources should be considered, including the cannabis wholesale tax, tobacco or vaping settlement, tobacco tax dollars, the Fund for Resilient Nevada, or other appropriate sources as related to substance use. And the final recommendation is to support a bill draft request in the 2027 legislative session that would double the annual state investment in primary prevention to protect prevention infrastructure via a general fund dollar line item committed to the Bureau of Behavioral Health, Wellness, and Prevention Programming for people aged 0 to 24. Money should be directed to local lead agencies that prioritize evidence-based programming. For example, if the current level of investment was 1.6 million, then this would be raised to 3.2 million for the next biennium. This funding should not be at the expense of existing programming and should be the state of Nevada's contribution to prevention efforts. Additional federal and/or monies that are secured would not change the target allocation of state dollars for primary prevention efforts. Any questions from the subcommittee before we pause for 5 minutes to give folks time to think through their ranking? All right, I'll be calling for a vote at 4:30. So see you all then. 5 minutes.
Can I ask a question and maybe open it for discussion? Sorry for those that I'm distracting while you're thinking, but as I'm thinking about prioritizing these, I'm torn between prioritizing based on like impact and prioritizing based on feasibility. And for me, the order is opposite when I go based on impact and feasibility. And so I just wonder if there's any guidance related to what we should be putting weight into when we're thinking about prioritization.
First of all, Jessica Johnson, for the record, I'm grateful that you are so thoughtful about how you're thinking about what to include here. These rankings will, my understanding, and Kim and Mary, correct me if I'm wrong, just influence how these are presented in the report. So the order in which they'll appear in the report. So what is listed as number 1, 2, and 3. We realized, I believe, after the first year that we did this report, that the order that these are listed in, people perceive in terms of relative priority. So to your point, that could be priority based on urgency. That could be priority based on feasibility. I think it could be priority based on, potential impact. I think all of those are detailed out for consideration. So I'd recommend in your mind kind of weighing all of them together with what you think makes the most sense for relative priority. Sorry, that's like a very non-specific answer, and I appreciate how thoughtful you're being about it.
And I would just note, Chair Johnson, that you were correct. It was a request that there be some prioritization or ranking so that folks who are reviewing the report, if, for example, there were multiple BDRs in a particular section, folks who might have ability to do that could get a better idea of what the subcommittee would have prioritized if they were able to have a discussion around it with, say, somebody who had that. That's just one type of example, and I don't know that that's the exact example that led to the prioritization, but that type of idea of where could folks help, they appreciated that prioritization.
I'm hopeful that non-answer answers your question. We are at 4:30. Do subcommittee members need additional time? All right. Member Cheatham, you are up first. If you'd be willing to come off of mute and share your ranking.
Sure. So it's gonna just go in order. That's gonna be 3, and then 2, and then 1.
And so I just want to confirm for the record, Member Cheatham, that you ranked supporting the bill draft request in 2027. You ranked that as the highest priority. Is that correct?
That's correct, yes.
Thank you. So what I have, and we're reading this back sort of for the record, although we also have it on the recording, is that Member Cheatham, you ranked it as requesting guidance from the Board of Pharmacy as a 3, creating the BDR for the youth vaping prevention was a 2, and then the BDR for the state investment in prevention is your number 1 rank.
That's correct, yes.
Thank you.
Thank you, Member Cheatham, and thank you for going first, although you braved it for us, Chelsea. Member Shanae, you're up next.
Thank you, Chair Noel Shanae, for the record. I ranked as the primary prevention as 1. That would be number 3 there. That would be my number 1 choice. My number 2 choice would be the Board of Pharmacy. And then my vaping would be number 3.
Thank you. And Member Shanae, are you able to see how I entered those numbers and do they match?
Yes, that is correct, what I have written. Thank you.
Thank you.
Thank you very much, Member Shanae. It appears from this list that I am next, so I'll go next. Mine are in the order they are on the screen. So 1 for number 1, 2 for number 2, and 3 for number 3.
Thank you. Does that look correct?
It does. Thank you. Member Morgan, you're up next.
I think I'll go 3, 2, 1 as well. But I will say that if I was prioritizing based on feasibility, I would flip it to 1, 2, 3. But I'm gonna go based on I'm gonna follow the leader, and I'm gonna go based on impact. So
Thank you very much, Member Morgan.
And can I just confirm, Member Morgan, did I get that correct? So Board of Pharmacy, you ranked 3rd, youth vaping 2nd, prevention 1, with
correct.
prevention being the highest.
Yes,
Thank you.
correct.
Thank you. Given Senator Neal's abstention being on the phone, which I think we support, given how visual this exercise is, Member Nelson, I wanted to turn it over to you. You're next.
I am ranking the first one about the Board of Pharmacy a 3. Number 2, I'm going to be doing 2, and number 3, I'm going to be doing number 1.
Thank you. Can you see that, Member Nelson? Does that look correct?
That is correct. Thank you so much.
Thank you. So what I will note is based on this, the way that the group has ranked it, we have confirmed that we have it entered here. We will do a double check after the meeting just to make sure no formulas went sideways on us and that the weight applied correctly, although I was watching it as I was entering and I saw the adjustments that appeared to be correct. We will do a double check, but short of that double check, what we're seeing currently is that the supporting the bill draft request for primary prevention funding was ranked as the number 1 recommendation. The BDR for youth vaping prevention was ranked as the 2nd. And then just right on the heels of that is the Board of Pharmacy being ranked as the 3rd for the prioritization. So it'll actually be flipped from what you see on the screen in terms of 1, 2, 3. That's how it'll be presented. 3, 2, 1.
Thank you, Kim. Any questions or comments from the subcommittee before we move to agenda item number 7? I want to thank you all for your contribution and staying closely aligned with our agenda to meet the goal today. I'm really grateful, despite tech hiccups and other areas, that we were able to both vote on and rank in a single meeting. So agenda item number 7 is for the prevention of the subcommittee recommendations for the June SURG meeting. Historically, the chair does present kind of our ranking process, what we considered, and a presentation of our ranked subcommittee meetings. I'm available to do that, but I do. Is there anyone else who'd like to present? If not, I'm happy as the chair to present those at the subcommittee meeting.
Jessica, I think you do a great job.
That's very kind of you, Wendy. I will be joining from Atlanta, so if my connection gets wild, Vice Prevention Vice Chair Nelson will be ready to hop in. But,
Oh gosh, let's hope Atlanta is okay. Thank you.
okay, thank you, and thank you all for your hard work on putting these together today. We can move on to agenda item number 8. I am noticing the time, so just by way of review for our subcommittee topics timeline for the next few meetings. In June, if there's any recommendation feedback from, we do have a prevention subcommittee meeting in June. We'll go over any details or feedback that we received at the larger SURG meeting. And then our September, November, and December meetings do start of a new report cycle. I'm grateful that it sounds like we have identified some subject matter experts who can help. We can hopefully bring into one of those meetings to help us continue to workshop some of the recommendations, either that we paused on today or that we want to continue to work on and elevate. So if you have subcommittee uh, speaker recommendations, I encourage you to share them with Mary O'Leary and any contact information. She's happy to reach out. After August, we'll be working on recommendations for the 2026-2027 cycle. So please send any recommendations you have to Mary. Sorry, next slide, please. The full SURG meeting and revised reporting timeline, just for your awareness. So again, in June, we'll review and vote on the final ranked recommendation and we'll approve the template at the larger SURG meeting. And then in July, we'll approve the actual annual report with the larger SURG meeting. And then in October, for the larger SURG meeting, we'll hear a presentation from subject matter experts in the October 2026 meeting. Any questions on this timeline from the group? Does that seem clear? Member Morgan?
Hey, yeah, this is Kyra again. I'm just curious if we have the dates for our actual meetings, just because like for me, June is just a hard month, and so I just want to try to coordinate that as far in advance as possible.
Great question. Mary, did you want to answer that?
Yes, Mary O'Leary for the record. They should be on the calendar. The subcommittee meeting as planned is Wednesday, June 17th at our usual 3 p.m. And then the full search meeting is the 10th at 2 p.m. on Wednesday, the 10th of June.
They're on my calendar. Please excuse me for being unorganized and not knowing that. Thank you.
No problem.
Thank you for asking, Member Morgan, and hopefully folks will be able to join as well with those dates. Any additional discussion on agenda item number 8? If you have any planning recommendations or you need those dates on your calendar, please reach out to Mary. She is happy to help and make sure folks have what they need. Given that, we'll move on to agenda item number 9. We'll review the draft proposed 2025 SURG recommendations. I know these slides will include recommendations from the other 2 subcommittee meeting minutes, and they're considered here just for information only. So the treatment and response subcommittee also may have additional recommendations, and they're included in the handout. Given where we're at on time, Mary, is there anything else additional you wanted me to be sure and mention here?
I think this is Mary for the record, that I would just point members to that handout that was posted in the April 8th SURG meeting materials that has all of those recommendations, that includes the justification and background and associated research and links and anything like that. That has all the information that we were going to go over today. It was just meant to be a refresher.
Fantastic. Thank you to you and the SEI committee for compiling those resources. I recommend folks review these in advance of the larger June SURG meeting to be prepared to ask any questions of our treatment and response partners. This PowerPoint presentation will also be available to you for review. Apologies. I know this was just for discussion only, but I do want to be sensitive on y'all's time, and you've already given me an extra 11 minutes so far. With this, we'll move on to agenda item number 10, which is our second period of public comment. Mary, I'll turn it over to you if there are any additional details we need to read out for the record.
Sure. So public comment will be received via Zoom by raising your hand or unmuting yourself when asked for public comment. Public comment shall be limited to 3 minutes per person. No action may be taken upon a matter raised under this item of the agenda until the matter itself has specifically been included on an agenda as an item upon which action may be taken. This is per NRS 241021. If you're dialing in from a telephone, please dial 253-205-0468. When prompted, enter the meeting ID 813-0733-6896. Please press *6 so that the host can unmute you.
Thank you, Mary. Do we have anyone for our second period of public comment? I see a hand raised for public comment. Please state your name for the record. The floor is yours.
Noelle Shanae here for the record. I just wanted to give another shout out and big thank you to everybody who developed and submitted these recommendations, as well as putting together the agenda. I know there was a lot of effort on the back end for all of this, so much gratitude to you all. Thank you.
Thank you for your public comment. Any additional items for public comment today? Hearing none, we'll move to agenda item number 11, which is adjournment.
I'm so sorry, Chair
Oh.
Johnson. Before you adjourn, I just wanted to confirm that the subcommittee did not intend to have a motion and vote on the rankings that were presented.
Oh,
And I apologize that I was updating the document with some notes and didn't catch that until just now.
thank you, Kim. This is why the SEI team keeps us honest, and we still have quorum. Am I able to move back to agenda item number 6, even though it's closed?
I believe so. I would defer
Reopen?
if our DAG has any opposition to that.
Can I reopen agenda item number 6?
Yeah, that's fine.
Okay. I'm going to reopen agenda item number 6 and call. I'd entertain a motion to vote on moving the recommendations forward as ranked for the 2025-2026 report.
This is Kyra. I'll move forward with the recommendations as ranked.
This is what I second that.
Thank you. I hear a motion and a second. All in favor say aye.
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 Motion is approved. Excellent catch, Kim. Thank you very much. We can close agenda item number 6 and now move to agenda item number 11.
And I'm so sorry, Chair Johnson, for the record, I did not hear any opposition, correct?
Correct. I heard everyone come off of mute in favor, and no opposition, no abstentions.
I do just want to note, I see the DAG has come off mute. Joseph, did you have a?
Do I need to ask specifically?
Yeah, we're gonna have to redo
Okay.
public comment.
Okay, we'll redo public comment. So given that, learning a lot today. Thanks everyone for hanging out here. We will reopen agenda item number 10, which is our period of public comment. Joseph, do we need to reread the guidance for those folks present?
Wouldn't hurt.
All right. Mary, over to you.
Alrighty, public comment will be received via Zoom by raising your hand or unmuting yourself when asked for public comment. Public comment shall be limited to 3 minutes per person. No action may be taken upon a matter raised under this item of the agenda until the matter itself has been specifically included on an agenda as an item upon which action may be taken per NRS 241021. If you're dialing in from a telephone, please dial 253-205-0468. When prompted, enter the meeting ID 813-0733-6896, and then please press *6 so that the host can prompt you to unmute.
Thank you, Mary. Do we have anybody for public comment?
Chair Johnson, I do not see any hands raised or anyone coming off mute.
All right. Thank you, Mary. We'll go ahead and close agenda item number 10. And now move to adjournment. I hope member Shanae doesn't take away her gratitude expressed earlier, but I want to share a big thank you to everyone on this meeting today for your hard work on both reviewing and ranking and voting on all of our recommendations. Looking forward to moving these forward for review by the full SURG in June. Take care, everyone. Have a great rest of your week.
Thank you.
Thank you.
Thank you.